So John, what is RPE?
RPE is an acronym that stands for Rehab, Perform, Evolve. Why Rehab, Perform, Evolve? We are a group of physical therapists. We've been in business about 24 years. And one of the things that we have come to realize is that access to healthcare is extraordinarily limited. And so rather than limit the amount of people that we can serve here in our 7 local clinics, we've designed an app-driven accountability paradigm, if you will, for clients and patients alike who can have exercise programming delivered to their phone, nutritional programming delivered to their phone, and actually get results that they want right here in the palm of their hand at any time. They don't have to be patients of balanced physical therapy. They can be anyone that goes through an application process to have access to their physical therapist to address orthopedic pains that they might have, including their past medical history, things that they've dealt with in the past, to design an appropriate training program for them. And if they want, they can add a nutritional programming layer onto that to accomplish whatever goals they might have. These things include weight loss, these things include building lean muscle mass, athletic performance, maybe just enhancing their physique or their appearance, all of the above. Or for the diabetic patient population, to get off some of their medications. Because we all know that for type 2 diabetes in particular, exercise and nutritional programming is better than, more effective than medication in many, many cases. It's also really beneficial for the diabetic patient population because exercise, when appropriately dosed, in addition to nutritional programming and education for a type 2 diabetic patient or client, often allows them to get off of or significantly reduce the amount of medication that they're taking.
Yeah, something that you mentioned was really important. One of the things we do during our onboarding and evaluation process is we do a goal setting call and go over all the goals they want to accomplish. And almost all time in our older population that we work with, they want to improve their cholesterol levels. They want to get off their high blood pressure medication and get off their metformin to improve their A1C.
That's fantastic. That's amazing. What's really remarkable about RPE is that we're not a group of personal trainers doing this. We're a group of doctors of physical therapy that have combined well over 100 years of clinical experience treating patients. And so we bring that knowledge base to any client that wants to become a client of RPE through our app, and can appropriately screen them at intake, make sure they're appropriate for the program in the first place, just like we would a patient coming into clinic. Are they actually appropriate for physical therapy, or do they need to be referred out to a physician or specialist of some kind? So all of the prospective clients coming into RPE will get that same type of evaluative screening before being allowed into the program. Once they're allowed into the program, they get a really, really high horsepower program delivered right to their phone with exercise and nutritional programming so that they can accomplish their goals.